Okay guys, kaya pa ba? Next naman natin is yung 100 items ng August 1997. Okay? So start na po natin. Wag na tayo magpatumpik-tumpik. Tumpik-tumpik pa. Okay, let's go with your number 1. Okay? A synovial joint possesses which distinguishing features? Okay, kapag synovial joint daw, ano ang characteristics nito? Okay? There is a potential cavity. It is a capsule of fibrous tissue lined with synovial membrane, yes. And it's also a lubricated articular cartilage. So tama po itong tatlong ito. These are all characteristics of a synovial joint. Okay, kasi meron po itong laman na synovial fluid. Okay? So letter dog, all of these. Okay? Number 2, one of the following is true of coronary circulation. Okay? Sino po dito ang natatanging tamang sagot? Okay? If you would look at your letter cut, tingnan niyo po yung letter cut niyo. A low cardiac output may give rise to angina pectoris as when the aortic valve does not close properly. Okay? So kung nagkakaroon kayo ng problems with the aortic valve, for example, in aortic stenosis, okay? Aortic stenosis, ang nangyayari po, there is a decreased volume of blood that exits the heart. Tama po ba yun? There is a decreased amount of blood that exits the heart. Therefore, nagkakaroon din po kayo ng limited blood supply in all parts of your body. Tama po ba? Okay? So kung bumababa po ang volume ng inyong blood na nag-exit outside of the heart, bumababa din ang inyong cardiac output. Therefore, in the coronary circulation, if there is a decreased blood supply to the important structures of your heart, okay, na nagsusupply ng blood, okay, there would be angina pectoris. Okay? You would experience angina pectoris or chest pain. Okay? Kasi hindi fully nabibigyan ng matinong blood supply ang inyong heart. Okay? For the other choices, okay, a rapidly beating heart prolongs diastole, mali po siya. It should be shortened. Okay? Kung rapid yan, dapat po shortened ang inyong diastole. Okay? Letter dog naman, on the other hand, its physiologic importance lies in the fact that the total anaerobic conditions are adequate in sustaining ventricular contraction, okay? Ang mali po dito, hindi po siya adequate. Okay? It should be inadequate. Okay? It should be inadequate. So again, for number 2, it's your letter cat. Okay? Letter cat. Number 3, which of the following statements is true? Okay, unahan ko na kayo. Based from your Basmayjan, if you would look at letter boy, the median nerve supplies all of the FPL and the adjoining half of the FDP. The median half of the profundus is supplied by the ulnar nerve. Tama po ba tayo dito? Yes, okay? Your FPL is innervated by the median nerve as well as your FDP, okay? The lateral portion of your FDP would be also innervated by the median nerve. But the medial portions of your FDP would be innervated by your ulnar nerve, okay? Your ulnar nerve. So number 3, letter boy. Number 4, when the scapula is stabilized, the following ranges of motion is attributed to the glenohumeral joint except, okay? So all statements here are from Brunstrom except your letter apple, okay? Letter apple, tingnan nyo si A. When the glenohumeral joint is ER'd to 90 degrees by active insufficiency of the brachialis muscles. Okay, tama po ba yun? Okay, your brachialis muscle does not even cross your GH joint. Ang action lang niya ay nasa elbow joint. Therefore, mali po si letter apple. Okay? Please replace the brachialis with your deltoids. Okay? It's the deltoids that have active insufficiency when the GH joint is externally rotated to 90 degrees. Okay? It's the deltoid. Okay? So, 4 letter apple. Okay, number 5. Function of ligaments include, letter apple, protect or hold in position some more important structure, usually a nerve. Tama po ba to? Yes, okay? It can hold certain structures like nerves, tendons, okay? Prohibits movements in undesired plane. Yes, yan po ay isa sa main function ng ligaments nyo. And also to limit the range or extent of normal movement. Okay? Kaya kayo nagkakaroon ng certain degrees of motion only for each joint. Okay? It's because of the action of your ligaments. So all of these are correct functions. Letter cat. Number 6. The security of the ankle joint is a result of an immobile act but not immobile and not rigid union of the following joint. Okay? So, sino pong immobile joint? Okay? Ang malapit po sa ating ankle joint. Okay? So, umakyat lang po kayo ng konti, you would see there your inferior tibiofibular joint. Tama po ba? Because if you can remember, your inferior tibiofibular joint is actually a syndesmotic joint. Okay? It's a syndesmosis type of joint. Okay, and we know that your syndesmosis is a synarthrodial joint wherein there is only minimal movement. Okay, that is required. Okay, hindi niya kayang maggumalaw masyado. There is only minimal movement in that area of the joint. Okay, so ang answer for your number 6, it's letter apple. Letter apple. 7. A patient is paralyzed from the waist down and has been using the wheelchair. The following procedures will allow the patient to go up and down the stairs except blank. Okay? So kung makikita nyo dito, there are different procedures that you can do in order to raise yourself up the stairs or go down the stairs. Okay? When the patient is paralyzed. However, i-highlight ko na sa inyo, check nyo si letter dog. Sabi ni letter dog, in climbing down, after positioning herself at the edge of the landing, she'll slide her buttocks and her hands onto each step, using her hands to position her legs onto the next lower step. So imagine nyo yun, magsaslide yung pasyente nyo sa hagdan. Diba? Ano magiging kalabasan nun? Bug, 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 bug. Diba? Gaganon siya. Bababa siya sa hagdan because of sliding technique. Hindi may injure naman ng puwet ng inyong pasyente on that. Okay? So you don't slide the butt on the stairs. Okay? Hindi kayo dudulas doon sa stairs. You slowly lower your butt with the use of your arms. Okay? You slowly control the descent of your buttocks onto the next step with the help of your arms. Okay? So for number 7, it should not be sliding. Okay? It should not be sliding. Instead, they should lower the buttocks and her hands onto each step. Okay? While using her hands to position her legs onto the next lower step. Okay? So for number 7, it's letter dog. Okay? Letter dog. Okay, number 8. This nerve innervates the superior oblique and exits the brainstem posteriorly, also known as the stupid nerve kasi it's the only one exiting the brainstem posteriorly. Sino po to? SO4. Sino po yung SO4? It's your trochlear nerve. Okay? Trochlear nerve. Letter dog. Number 9. Functions of veins include letter A, stores large quantities of blood and make it available when required. That's why it is called the capacitance vessel because it can contain large amounts of blood. Okay? So tama po yan. Letter B, propels blood through venous pump. Tama rin po ito because your veins would have valves. Okay? In order to prevent backflow of the blood towards the foot. Okay? So para tumaas siya, meron kang valves. Okay? And at the same time, it regulates cardiac output. Yes, of course. It regulates cardiac output. So, for number 9, it's letter cat. All of these. Okay? Number 10, in the central part of the mediastinal part of the medial surface is large area where bronchi and pulmonary vessels plunge into the lung. Okay? Name this part. So, kapag po, for example, you draw your lungs. Okay, kapag po drawing natin si lungs, makikita nyo that in the lungs, okay, there's a portion there where the bronchi and other arteries and veins would be plunging towards the inner part of your lungs. Okay, meron siyang butas dito. So para pumasok yung inyong, okay, bronchi and your vessels, 'di ba? Okay? Now, what do we call this hole? Kung saan po pumapasok ang inyong bronchi and blood vessels, that would be your hilus. Okay? That would be your hilus. Letter apple. Okay, letter apple. 11. Functions of the pretibial group except, okay, what is the pretibial group? These are your ankle dorsiflexors, okay, your ankle dorsiflexors, also your toe extensors. Okay, nandito po sila nakalocate. Letter A, anterior tibialis is the primary dorsiflexor. Tama po yan. Paralysis of the muscles result in drop foot during the swing phase. Tama po yan. They cannot hold the ankle in dorsiflexion or in neutral position. Therefore, kumakayod tuloy yung paa nyo on the floor. Okay? Important in many open chain motion, that is in placing the foot for driving. Yes, di ba? Kung itataas nyo yung ankle nyo towards dorsiflexion para ilagay siya on the pedal, then yes. Okay? Yan po ay function ng pretibial group. But for letter dog, open chain motions of the foot requires a lot of muscle force due to poor leverage. Tama po ba ito? Okay? Yan po ang mali. Okay? Letter dog po ang ating mali. Bakit po? It's because based on your Brunstrom, sabi ni Brunstrom, open chain motions of the foot require little, okay? Little muscle force because the weight of the foot only about 2 pounds and the muscles have good leverage. Okay, so there's only little muscle force because the foot weighs only about 2 pounds and the muscles have good leverage. Okay, so ang mali po is letter dog. Okay, maganda po ang leverage and therefore there would also be less force required. Okay, so for your number 11, it's letter dog. 12. The following statements apply to crutch walking up the stairs, non-weight bearing right, except, okay, tingnan nga natin yung choices natin. Letter apple, to move up onto the next step, patient pushes down on his crutches and hop onto the first step with the left foot. Okay, the other leg moving up onto the step at the same time. Okay, tama po ba ito? Yes, that is correct. Okay, letter cat, after moving left foot on the next step, the patient swings up the crutches onto the next step alongside his feet. Tama po yan. Okay? Instruct to grasp the banister or the railing of the stairs with his left hand and shift left crutches to the right hand, supporting his weight on both crutches and his left leg. Okay? Tama po yan. Okay? Humawak ka sa railing and yung isa naman, nandun nakahawak both your crutches. Okay? Letter egg, stand at the bottom of the stairs behind the patient, slightly to his right. Yes, para po masalo nyo siya in case mawalan siya ng balanse. Sino po ang mali? It's letter boy. Look at letter boy. Instruct the patient to grasp the banister or the railing of the stairs with his left hand and hand crutches to physical therapist, supporting his weight on his left leg. Tama po ba ito? Okay. Mag-grasp ako ng banister or ng railing with the left hand and with my left foot, okay? Nandito yung support ko. Tapos yung crutches ko, ibibigay ko kay PT, okay? So yung meaning to say, the right hand has no support, the right leg has no support. Ang support mo lang nasa left. So paano ka aakyat ng hagdan yan? Okay? Malakasang pull yan. 1, 2, 3, talon! Boog! Di ba? So that wouldn't be a necessary move for your patient, di ba? You wouldn't hand the crutches to the physical therapist kasi kakailanganin yan ng pasyente. Okay? So you would not hand the crutches to the PT, okay? You give the crutches over to the right arm para meron siyang support on the right. Okay? So while I'm holding the banister here, I'm holding my crutches on the right side. Okay? So for number 12, it's your letter boy. Okay, letter boy. 13. In polyneuropathy, lesions often occur bilaterally and the effects are usually more prominent in the proximal than in the distal parts of the extremities. Tama po ba ito? Okay. The first statement is true. Okay. It usually occurs bilaterally. But for the second statement, it does not start in the proximal area first. Okay? It usually is more prominent in the distal parts of your extremity. Okay? Before the prominent. Okay? So, mauuna yung distal than the prominent. So, okay? For number 13, it's your letter boy. First statement is true. Second statement is false. Okay? 14. Okay? The following statements describe the factors affecting a cell's net rate of diffusion in one direction except blank. Okay? I'll just generalize it. Most of the statements here are correct. Ang mali po dito, it's letter boy. Tingnan nga natin. In ions, the difference in chemical potential between the two sides of the membrane. Tama po ba ito? Okay, since ions ang pinag-uusapan natin, this would not be on the chemical side, this would be more on the electrical side. Okay? So, if we're going to reterm this statement, okay, in ions, the difference in electrical potential, okay, in electrical potential between the two sides of the membrane. Okay? So, dapat po electrical. It should not be chemical. Okay? So, again, for number 14, it's letter boy. Okay? 15, decrease in resting membrane potential, making it more positive. Okay? So, kung mas naging positive ang resting membrane potential ng inyong cell, okay, there would be an action potential occurring. Therefore, there is depolarization of the cell. Tama po ba yun? That is your letter boy. Okay? Depolarization pag nagiging positive ang resting membrane potential. 16, which of the following is true of the patella? Okay, tingnan nga po natin. Letter A, it does not have a constant relationship with the fibula. Tama po ba? It is more with the tibia and the femur. Okay, kasi yung fibula natin, wala naman siyang participation in the first place when it comes to the knee. It's only the tibia and the femur. Okay, what else? It is easily dislocated medially due to the powerful extensors of the knee to pull oblique and chiefly from the lateral side of the thigh. Okay? Mali din po to. Okay? The common direction of patellar dislocation is towards the lateral side. Okay? It's towards the lateral side. Okay? If weak, for example, yung VMO ng inyong quadriceps, okay, tendency is the patella will not be stabilized appropriately, therefore, nagsuswitch siya towards the lateral side. Okay? So, dapat lateral, not medial. So, ang correct lang dito is your letter dog. Okay? It is a sesamoid bone and a tendon and is said to enhance the power of knee extensors by increasing the leverage of that muscle. Diba? Yan yung ating pinag-usapan kanina. So, for number 16, that's your letter dog. Okay, number 17. The following statements describe a lower motor neuron paralysis except. Okay, so let's check yung mga choices po natin. So letter A, Babinski sign is not present. Tama po ba ito? Yes, okay, you won't expect a Babinski sign in a lower motor neuron paralysis. It is more for your upper motor neuron paralysis. Okay? When you say naman weakness of movement is due to a lesion of the motor cell or its axon, yes, tama rin po ito. Muscle fasciculations may be present, yes, mas makikita po natin to in a lower motor neuron paralysis. Characterized by diminished tonus, yes, mas mababa po ang tone ng ating patients with LMN. So, you're left with letter egg. Ano nakalagay? Reflex arc is interrupted resulting in exaggerated stretch reflex. Again, di ba kapag lower motor neuron, it should be more of a diminished stretch reflex, not exaggerated. Kasi po, pag exaggerated to, this is an upper motor neuron paralysis. Okay? So for this one, it's letter egg. Okay? Number 18, procedures performed together to relieve pain by excising the synovial membrane and removing diseased cartilage, soft tissue, and the bony enlargement from joints. Oh guys, tingnan nyo po kaagad, meron na kayong keywords for the question. Excising the synovial membrane. Excising meaning may kailangan kang tanggalin. Diba? When you're talking about surgeries wherein you're required to remove something from it, it is more of your ectomy. Yung mga ectomy natin na dulo. So, kung synovial membrane, it should be synovectomy, correct? So, hanapin natin, meron bang synovectomy? Meron. So, you have your debrima and your synovectomy. That's your letter dog. Okay? Your letter dog. Number 19. This muscle inserts into the iliotibial tract and into the gluteal tuberosity of the shaft of the femur, posterior aspect. Okay, tingnan nyo kaagad yung mga muscles nyo na naka-enumerate dito. Okay, your A, your B, and your C are all hamstrings. Tama po ba? And your hamstrings would be inserting at the level of the knee joint. Okay, hindi na po sa hip joint. So the only muscle here that would insert both in the iliotibial tract and at the same time at the gluteal tuberosity of your femur, okay, would be your letter dog. Tama po ba? It's your gluteus maximus. Okay, letter dog. Number 20. Which of the following events are required for the mechanical linkages between the actin and myosin to produce muscle contraction? Okay, tingnan nga natin. Letter boy, chemical reaction to provide energy of active tension. Tama po ba ito? Yes. Okay, there will be a chemical reaction in order to stimulate the mechanical linkages between your actin and your myosin filaments. Letter dog, a specific stimulus to trigger the coupling of the two filaments. Tama po ba ito? Yes, once na nag-meet na po ang calcium with your troponin group, 'di ba? Magre-reveal po ang active sites ng ating actin filaments and then the myosin heads will be attracted to them causing your muscle contraction. Okay? So tama po to. Letter cut, both of these. Okay? Number 21, the hind foot is composed of the following bones. Okay? So pag sinabi nating hind foot, this would be the one at the posterior aspect of the foot. So if you would draw the bones of your foot, okay? So drawing ulit natin, you have your talus, you have your calcaneus, you have your navicular, meron kang cuboid, meron ka ditong tatlong cuneiforms, meron ka ditong metatarsals. Okay, and you have your phalanges. So lagay ko na lang muna isa-isa kasi para mabilis. Okay, your hind foot would be this area, your midfoot would be this area, and your forefoot is this area. Okay, so pag sinabi nating hind foot, it's the posterior portion. Sino po yung mga bones na nandun? It's your talus and your calcaneus. Okay, so meron po ba ditong choice na talus and calcaneus? Yes, it's your letter dog. Okay, your letter dog. Number 22, mobility of the shoulder joint is made possible by these bony articulations. Okay, sino-sino nga po ba yung mga shoulder joints natin? Our true shoulder joints, you have your sternoclavicular, your acromioclavicular, and your glenohumeral joints. Lahat po ba sila nandito? Okay, you have your SC joint, your AC joint, and your GH joint. Lahat po nandito. So, all of these. Okay, letter apple. All of these. 23. Muscle for inward rotation of the glenohumeral joint. So, all of your choices are part of the rotator cuff muscles. Okay, sino lang po sa kanila ang responsible for internal rotation? Your supraspinatus is for abduction. Your teres minor and your infraspinatus are for external rotation. So, sino lang natira? It's your letter cut. Your subscapularis, which is for internal rotation of the GH joint. Okay? 24. Inversion and eversion of the foot occurs at which joint? Okay, at which joint? Sino po yun? It's your letter apple, your subtalar and transverse tarsal joint. Okay, dito po nag-o-occur ang ating inversion-eversion movements of the foot. Okay, letter apple. 25. Unilateral contraction of this muscle combines rotation of the head to the opposite side, lateral flexion to the same side, and head and cervical vertebrae extension. So ano ulit? Rotation of the head to one side, so opposite side, pero lateral flexion on the same side. Okay? So this one. And then also cervical extension. So kung ginawa nyo to, mararamdaman nyo na kaagad. Okay? Sino po yung muscle na to? It's your SCM or your sternocleidomastoid. Letter cat. Sir, nakakapagtaka, bakit naman po head and cervical vertebrae extension? Di ba po ang SCM natin is more for cervical flexion? Well, based from your Brunstrom, okay, sabi kasi ni Brunstrom, the SCM which completely bridges the cervical vertebrae requires synergistic contractions of the vertebral muscles to stabilize the cervical spine so that the SCM can produce a flexion motion. Okay? However, without these synergistic contractions of other muscles around your neck, okay, the isolated contraction of the SCM causes extension of the head and an increase in the lordotic cervical curve. Okay? So based from the action itself of your SCM, isolated action, it would be more of your cervical extension rather than flexion. Okay? Yung flexion, nangyayari lang po to together with synergistic contractions of other muscles in your neck. Okay? So again, for number 25, ang pinakapasok po dito is letter cut your SCM. Okay? 26. The following statements apply to the bicipital groove except, okay, unahan ko na ulit kayo dito guys. Tingnan nyo yung letter egg. Ano sinabi? Bordered medially by the greater tuberosity and laterally by the lesser tuberosity. Okay? When you see your bicipital groove, okay, ang tama po dapat dito is vice versa. Okay, vice versa. So, paano yun? It is bordered laterally by the greater tuberosity and medially by the lesser tuberosity. Okay, dapat po baliktad. Okay, so for number 26, it's letter egg. Okay? 27. In Herb Duchenne palsy, the following conditions apply except blank. Okay, so sino po ang tamang sagot for number 27? Okay? So, tingnan nyo maigi. Pag sinabi nating Herb Duchenne palsy, sino pong mga nerve roots ang usually na-affect dito? It would be the mid-cervical roots, okay? Or the upper portion of your brachial plexus. So, it's C5 and C6. Sino pong namali? It's letter boy. Masyadong tumaas. C3 and C4 roots daw ang naapektuhan. So, therefore, okay, ang mali po dito is letter boy. It should be again C5 and C6. Okay, the upper roots of your brachial plexus or the mid-cervical region of the body. Okay, so letter boy. 28. This injury causes paralysis of the pronator teres and quadratus. Sino po ang nag-i-innervate sa ating pronator teres and ating pronator quadratus? It's your median nerve. Okay, your median nerve, meron po ba? Yes, okay, it's letter cat. And it should be clarified that it should be above the elbow. Okay, at the level of the elbow. Bakit po? Because your pronator teres is at this level, di ba? Your pronator quadratus naman is at the wrist. Okay? If it's at the level of the wrist, baka hindi po naapektuhan si pronator teres and quadratus at all. Okay? So, dapat po above the elbow. So, tama po, it's your letter cat. Okay, letter cat. 29. Relatively rapid, irregular, recurrent, unpredictable, non-rhythmic, involuntary movements of the trunk, face, and of extremities. Sino po kaya ito? Okay, when you say rapid, irregular, samahan nyo na ng jerky movements. Okay, sino pong type of movement disorder ito? It's your chorea. Tama po tayo dyan. Okay? It's your chorea. Letter dog. Okay? 30. The following statements apply to ginovalgum except, okay? So, pag sinabi nating ginovalgum, ano po ang tamang sagot? O guys, unahan ko na ulit kayo. Check nyo again si letter egg. Letter egg. May be associated with recurrent dislocation of the patella because of increased medial force on the patella. O guys, di ba? When we already know that the patella is usually displaced not medially but rather laterally. Tama po ba? And during your ginovalgum, okay, there is lateral displacement or an increased lateral force on the patella kaya siya nagkakaroon ng abnormal lateral patellar tracking. Okay? The reason why many of them would have pain on the knees. Okay? Kasi meron ng abnormal lateral patellar tracking. So, ang mali po dito is hindi dapat siya medial force. It should be a lateral force on the patella. Okay? Lateral force on the patella. Number 30, it's your letter egg. Okay? 31. The human torso's nerve supply of an orderly series of spinal nerves is evidenced by its segmental development, one pair of spinal nerves supplies the strip-like area of skin. This is known as a blank. Oh guys, madali na lang po to. Kapag yung isang nerve root ay nag-supply ng isang area ng skin nyo, that would be your letter apple. Tama, your dermatome. Okay, your dermatome. 32. In flexing the knees and hips and dorsiflexing the ankles, objects may be lifted from the floor. The following positions of the pelvis and vertebrae are used. Okay? So based from your Brunstrom, there would be two. Okay? There would be two positions of the pelvis for this one. It includes posterior tilt of the pelvis with kyphotic position of the vertebrae plus anterior tilt of the pelvis with lordotic position of the lumbar spine. Okay? So pasok po ba both choices? Yes. Okay? Your A and B are correct. Okay? Based from your Brunstrom, it's letter dog. All of these. Okay? All of these. 33. The following statements are true of the clavicle except, okay guys, I want you to check your letter apple. Ang sabi daw, when clavicular rotation is prevented, arm elevation is limited to 90 degrees. So kapag daw hindi nagkaroon ng posterior rotation ang inyong clavicle, hanggang 90 degrees lang daw. Tama po ba ito? Okay? Sabi po ni Brunstrom, it's not 90 degrees, but rather it should be 110 degrees. Okay? The shoulder arm elevation would be limited to 110 degrees. Okay? 110 po dapat. Okay? Number 34. The paired spinal nerves are as follows. Okay? So, ilan nga po ba yung spinal nerve roots ng ating spinal cord? Okay? So, kung bibilangin nyo, you have 8 cervical, you have 12 thoracic, you have 5 lumbar, you have 5 sacral, and you also have 1 coccygeal. Tama po ba? So meron po ba mga nakalagay dito sa choices natin? 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal. That's your letter apple. Okay? Your letter apple. Okay? Number 34. Okay. Next, number 35. If your patient cannot support weight on one leg but has good muscular strength and coordination, which crutch walking gait would you choose? Okay? So sabi po sa isang napakalumang libro po na ginagamit po for your board exam, it's your providing early mobility. Okay? This type of crutch walking gait is what we call your swing through 3-point gait. Your swing through 3-point gait, that's letter dog. Okay, that's letter dog. So usually, we recommend this type of gait pattern for patients with spina bifida, patients with myelomeningocele or paraplegia. So because this gait would allow the patient to ambulate faster. Okay? They can ambulate faster compared to other gaits. Okay? So again, for number 35, it's your letter dog, swing through 3-point gait. Okay? 36. This channel communicates with the periosteum at the bone surface and receives fluid from the Haversian canal. Okay? Sino po itong channel na ito? This would be your letter apple, your Volkmann's canal. Okay? Your Volkmann's canal. 37. The spinal cord tapers at the level of the lower border of the first lumbar vertebra called, okay, sino nga po ba yung tapered end ng ating spinal cord? That's what we call your letter dog, your conus medullaris. Okay, kung corpus yan, pakipalitan dapat po conus. Okay, conus medullaris. Okay? Number 38. Using the arthroscope and supplementary instruments, which of the following procedures can be performed? Okay? So when you're performing arthroscopic surgery, so together with other treatment procedures, sino po ang mga pwede natin gawin? Okay? Draining of a septic tank, yes. Biopsy of synovial disorders, pwede din po. Removing loose foreign bodies and adhesions, tama din po to. Smoothing knee cartilage irregularities from chondromalacia patella, tama din po ito. Okay? Tama po lahat ng ating procedure. So, all of these. Okay? Number 38, all of these. 39. CSF is formed primarily by specialized tissue in the ventricles called, guys, sino nga po ba tong apparatus na ito sa ating brain na nagpo-produce ng ating CSF? It would be your letter CAT. Tama po ba? Your choroid plexus. Okay? Your choroid plexus. The rest, they are meninges. Yung mga naka-enumerate pong other choices dito. Your dura mater, your pia mater, the meninges, okay? They are coverings of our CNS. So, hindi po sila ang sagot. Letter CAT po dapat. 40. The whole process by which depolarization of the muscle fiber initiates muscle contraction is called excitation-contraction coupling. During this process, the following events occur except. Okay, tingnan nga po natin ang choices. Okay? So, based on your choices, tingnan nga po natin, letter dog. Check nyo si letter dog. Ano sabi daw? Norepinephrine is released into the myoneural junction. Tama po ba ito? Diba? There is only one neurotransmitter na ginagamit in between, okay? Or inside your myoneural junction. Sino po yun? It should be your acetylcholine, tama po. Okay? It should be acetylcholine, not your norepinephrine. Okay? So, ang answer natin dito, it's letter dog. Okay? Letter dog. 41. Acetylcholine is released at the vagal nerve endings through the stimulation of the parasympathetic nerves to the heart. Effects of this hormone include, okay guys, kung ito ay parasympathetic in nature, okay, what would be the response of our body if it's parasympathetic stimulation? A, slow transmission of cardiac impulse to the ventricles. Yes, babagal po siya. Letter dog, decreases the rate of rhythm of the sinus node. Yes, babagal din po yung pag-deliver ng impulses from your SA node. Okay? So, both of these. Number 41, it's both of these. 42, muscle contraction strength is increased in the following manner. Tingnan nga po natin. Increasing the frequency of stimulation of individual motor units. Yes. Okay, kung meron pong increased stimulation frequency, that would cause increase of muscle contraction. Motor neurons with the smallest innervations ratio are activated initially. Yes. Okay. Diba nga po, napag-usapan natin, laging mauuna yung merong smallest innervation bago po yung may largest innervation. Okay? Letter dog, simultaneously increasing the number of activated motor units. Yes. Okay? The more na mag-activate pa kayo ng maraming motor units, the more nalalakas din yung contraction ng inyong muscle. So therefore, number 42, it's all of these. Okay? All of these. 43. The structure separates the left and right cerebral hemisphere. O guys, pag nakita nyo ulit ang inyong brain, okay, so kapag nakita natin siya in the top view portion, meron kang mahabang, okay, mahabang harang or hati dito sa ating brain, which divides your cerebrum into left and right hemispheres. Tama po ba? Okay, sino nga po yun, yung harang na yun or yung malaking gap between the two hemispheres? It's your median longitudinal fissure. Okay, your median longitudinal fissure. Letter boy. Okay, letter boy. 44. Synovial joints have the most complex structure and permit maximum mobility and include, okay, letter apple, all of these, none of these. Sino-sino po? Joint capsule, articular cartilage, and synovial membrane and cavity. Lahat po ba to ay makikita natin sa isang synovial joint? Yes, okay, makikita po natin yan lahat. Meron kang capsule, meron kang cartilage, meron ka ding synovial cavity and membrane. So lahat po to, all of these, ang ating sagot. Okay? 45, a fracture line that forms a right angle with the bone's axis. So kung magdodrawing kayo ng buto, for example, okay? Kung magdodrawing ako ng buto dito, so if merong fracture line na nag-occur that is in a right angle, with respect to the bones axis or longitudinal axis, that would be termed as your letter boy. Okay? Tama po. It's your transverse fracture. Okay? Kasi pag transverse, it comes across, okay, the bones axis. Okay? Pag oblique naman po, it would be a diagonal. Okay? It would be a diagonal line of fracture. So for number 45 again, it's transverse. Okay? 46. Increase in resting membrane potential making it more negative. O guys, 'di ba nga ang ating resting membrane potential is usually negative, okay? In the normal range it would be in a negative status. Pero kapag po mas lalo pa natin ginawang negative, okay, yung resting membrane potential, what would be the term for this? Ano nga po to? It's your letter dog, your hyperpolarization. Okay, your hyperpolarization, letter dog. 47. The following statements are true of arthroscopy except. Okay, tingnan nga po natin yung choices. Apple, particularly useful in diagnosing conditions, that is meniscal disorder and cruciate ligament injuries. Yes, okay. Pwede nyo pong i-check ang inyong cruciates and your meniscus for this type of diagnostic procedure. Letter cat, it is contraindicated for patients with a bleeding disorder. Yes, bawal po to sa mga pasyente, like for example with hemophilia. Okay, kasi po, baka po maging aggravated lalo yung bleeding inside the joint. Okay? Letter egg, the visual examination of the joint interior using a fiber optic lens instrument attached to a light source. Yes, okay? Yan po ang ating arthroscopy. Okay? Now, we're only left with your letter boy and your letter dog. Okay? So, medyo tricky to kasi there may be some possible answers na pwede nating isipin na possible ang sagot. Okay? Si letter boy kasi, most useful in diagnosing conditions of the posterior and middle third of the medial meniscus. Okay? For this one, it depends on what type of surgical technique, okay, ang gagamitin nyo for your arthroscopy. Okay? You have your outside-in technique and you also have your inside-out technique. Okay? This one wherein mas useful siya for posterior third and medial third of the medial meniscus, this would be applicable for your inside-out technique. Okay? Your inside-out technique. But if you're performing an outside-in technique of arthroscopy, the structures that would be most useful for diagnosing would be the anterior third and the middle third of the medial meniscus. Okay? Magkaiba. Okay? Magkaiba. But, considering pa rin that there is a technique in arthroscopy that would be useful to view your posterior third and middle third of the medial meniscus, we can still consider this as a correct statement. Okay? So, sino na lang po ang magiging choice natin dito? It would be your letter dog. Bakit po? Ano sabi daw? It is both a diagnostic procedure and treatment. Tama naman po yun. However, it involves very little knee trauma. Okay? So, medyo may superlative na tayong adjective dito. Very little knee trauma. Okay? That's not usually the case for a patient undergoing arthroscopy because in arthroscopy, okay, one of the adverse effects of this would be inuunti-unti niyang nababawasan or nasisira din yung meniscus kapag minsan pinapasok nyo maigi yung camera inside the knee. Okay? So although it doesn't require a big open incision on the knee joint, okay? Minsan meron pa rin siyang nasisira inside. Okay? Meron pa rin siyang nasisira inside the knee joint. Okay? But compared to other surgical procedures like your arthrotomy, for example, okay, mas mababa yung knee trauma ng ating arthroscopy. So I think what would be the best adjective for this would be, it involves less knee trauma. Okay? Less lang na knee trauma, but not particularly very little knee trauma. Okay? Not particularly very little knee trauma. Okay? So ang answer natin dito would be letter dog. Okay? Letter dog. 48. In actions such as jumping with knees bent, the femur has a marked tendency to slide forwards of the plateau-like tibial surface. This ligament resists this tendency. O guys, kapag daw po ang femur ay nag-slide forward, okay, so kung sa tibia naman to, this would be posterior movement. So pag ganun. Tama ba? Pag ganun. Okay, sino pong cruciate ligament ang nagpe-prevent po ng forward translation ng ating femur on the tibia? That would be your letter apple. Okay? Your letter apple, your posterior cruciate ligament. Okay? Your PCL. 49. If your patient cannot support his weight on one leg but has normal use of his arms, upper body, and other leg, which crutch walking gait would you choose? Okay, guys? If hindi niya kaya mag-support on one leg, it means that one leg is not weight-bearing on the floor. Okay? So, sino po yun? It would be your letter boy. Okay? Tama po ba? It's your 3-point gait or your non-weight-bearing type of crutch walking pattern. Okay? It's your letter boy. 50. Which of the following statements is true of lesions of the basal ganglia? Okay? Kapag po natamaan ng ating basal ganglia, ano po yung pwede niyang manifest? Okay? Muscle tone abnormalities and involuntary movements. Yes. Okay? Magkakaroon ka talaga ng involuntary movements for a patient who has a basal ganglia pathology. Disorders involving initiation of movement. Tama din po ito. Okay? Nahihirapan sila magsimula. Okay? Na gumalaw or mag-initiate ng movement. Difficulty in continuing and stopping movement. Yes, pag kunyari tuloy-tuloy naman yung kanilang paggalaw, okay, they cannot find the means to stop, okay, the movement of their body. Okay? So for number 50, lahat po to ay tama. All of these. Okay? 51. A fibrous type of joint that tightly connects the articular surfaces of two bones but permits minimal movement. Okay? So, ang clue niya dito would be the fibrous type of joint as well as the minimal movement that it permits. Okay? So, for this one, pwede nyo nang tanggalin si cartilaginous and your synovial. Okay? Kasi hindi naman sila fibrous type of joint. You're only left with your syndesmosis and your sutures. Okay? However, you can already remove here your sutures. Okay? Because there are sutures that can be found in the skull of our skeletal system. Your sutures would not provide movement. Okay? They would not provide movement at all when it comes to the skull. Okay? Talagang fused na itong mga joints na ito. Okay? So you're left with your letter apple, your syndesmosis. What would be an example of your syndesmosis? Again, if you would go back to the inferior tibiofibular joint of our body, this is one type of your syndesmosis. Okay? Your syndesmosis. Letter apple. 52. These effects result in aerobic energy depletion in the early stages of heavy exercise. So kapag po ang isang patient ay na-expose to a long period of aerobic exercise, ano po kaya yung pwede pong ma-deplete, okay? O pwede pong magkaroon ang inyong pasyente? You can have an oxygen debt. Tama po ba? Okay, tataas yung oxygen debt nyo. What else? Depletion of glycogen stores. Yes, mangyayari din po ito. Okay, in a patient who has aerobic energy depletion in the early stages of heavy exercise. So, both of these, okay? Letter apple, both of these. This type of contraction stabilizes joints and produces force with no gross change in the joint angle. Okay? So kung merong increase in muscle tension or muscle force, okay? Pero there's no change in muscle length or in joint angle, okay? So kapag kinontract ko lang ang isang muscle without any joint movement or muscle lengthening or muscle shortening, that would be your isometric type of contraction. Okay? Tama po ba? That's your isometric contraction. Okay? Pag sinabi naman nating isokinetic isokinetic. It's the same velocity of the muscle movement all throughout. Okay? It's the same muscle velocity. Pag sinabi naman nating eccentric, it's muscle lengthening. Okay? Pag sinabi nating concentric, it's muscle shortening. Tama po ba? So for number 53, again, it's your isometric. Okay? 54. Functions of the cerebellum include, so ano po ang mga function na yon? Letter boy, it receives proprioceptive impulses via the spinal cord or spinocerebellar tracts from tendons, joints, and muscle. Yes, okay? Important po yun dahil po nagpapadala po sila ng mga proprioceptive impulses, okay, towards your cerebellum so that your cerebellum can help modulate for balance function. Okay? At the same time, in contribution for that balance function, it also receives proprioceptive impulses from the semicircular canal. Tama po ba? Because our semicircular canals are important for dynamic equilibrium. And also, part of your cerebellum's function would be dynamic equilibrium. Okay? Dahil pinoprovide yon ng impulses or afferent impulses coming from your semicircular canals. So therefore, lahat po ba to tama? Yes, tama po lahat to. All of these. Okay? Number 54, all of these. 55. When muscle contracts to operate and so regulate the speed and power of another prime mover, it is said to be a blank. Okay? So kung siya po ay nagko-contract together with the prime mover so that the speed and power is regulated, this would be your letter cat. Okay? It is still letter cat. Your synergist, this is based from the definition of Basmajian. Okay? Ito po ang definition ni Basmajian for your synergist. Okay? Letter cat. 56. The final stage of mitosis where the two sets of daughter chromosomes are pulled completely apart. Ano po ang final stage ng ating mitosis? Okay? Diba? Una, prophase, metaphase, anaphase, and lastly, it's your telophase. Okay? Your telophase, letter cat. 57. The human peripheral nervous system is composed of ilan po? Okay? You have 12 pairs of cranial nerves. Tama po ba? You have from 1 to 12. And you also have how many pairs of spinal nerves? So, bilangin natin. Okay? Bilangin natin ang spinal nerve roots nyo. Again, you have 8 for your cervical. Okay? You have 12 for your thoracic. You have 5 for your lumbar, you have 5 for your sacral, and 1 for your coccygeal. Okay? So kung i-add ko to, 8 plus 12, 20, 25, 30, 31. Okay? So you have 31 spinal nerves. Okay? 31 pairs of spinal nerves. So ang answer natin would be letter cat. 12 pairs of cranial nerves, 31 pairs of spinal nerves. Okay? Letter cat. 58. Myelin sheath is possessed by peripheral and central nerve fibers, but only peripheral nerve fibers additionally have blank. Okay? Sino po ito? It's your letter boy. Okay? Your letter boy. Your neurolemma. Okay? It's your neurolemma. 59. In the OAB blood group system, the agglutinins responsible for causing transfusion reactions develop spontaneously. Whereas in the RH system, spontaneous agglutinins almost never occur. Okay? Tama po ba ang ating mga statements? Okay? Based from your Guyton, okay? Tama po pareho ang statements na nakalagay. Okay? So OAB, it's spontaneously developing, okay, pag nagkaroon ng reaction between your agglutinins. But in terms of the RH system naman, the spontaneous agglutinins almost never occur. Okay? Almost never occur. So for 59, it's letter dog. Okay? Number 60, this muscle is innervated by 2 branches of the femoral nerve, performs hip flexion and knee extension. Okay? The tendon of origin may be palpated in the V-shaped area between the sartorius and the TFL when the hip is flexed. Sino po to? Okay? Given the choices that you have, these are all part of the quadriceps femoris. Okay? Sino lang po sa quads natin ang nagko-crossover from the hip and the knee? Sino lang po yun? It's your letter boy, right? It's your rectus femoris. Okay? Your rectus femoris. 61. The ability to hold the arms extended above the head is impaired in weakness of the shoulder girdle from any cause. The following statements are true when testing for shoulder and arm strength except, okay, sige, uunahan ko na po ulit kayo dito. For your number 60, the answer here is letter apple. Bakit po? In letter apple, basahin natin, when the serratus anterior is weak, the upper angle of the scapula will wing out and be displaced medialward and up. Tama po ba? Is it the medial angle? Okay? It's not the medial angle. Rather, it should be, it's not the upper angle rather. It should be the lower angle. Okay? It should be the lower angle. Okay? So for number 61, it's letter apple. Okay? It should be the lower angle. Okay? The lower angle. For 62, the following precautions must be observed when turning patients after internal fixation except, okay, uunahan ko na ulit kayo dito, all of the other statements are true except your letter egg. Bakit po? Sabi, as the patient turns, support affected leg in adduction and once repositioned, keep hip and knee elevated on pillows in a higher plane as the unaffected leg. Diba? May contradiction na kaagad. Sabi kanina, dapat daw naka-adduct. Pero pagdating doon sa position na yun, kailangan nang itaas yung paa. Okay? Kasi ilalagay mo ng pillows. Okay? Would that still be adduction? Okay? That would already be abduction. Okay? So to correct this statement, as the patient turns, support affected leg in abduction. Okay? And once repositioned, keep hip and knee elevated on pillows in a higher plane as the unaffected leg. Okay? Clear po ba tayo when it comes to that? Again, 62, it's letter egg. 63. The following statements apply to the scalene muscles except blank. Okay? Ano po dito ang mali sa mga options na binigay sa atin? Okay? Based from your Brunstrom, the answer here would be letter apple. Bakit po? Extends the cervical spine with bilateral contraction. Ano nga po ba ang action ng scalene muscles natin? If it's bilaterally contracting, it should be flexion. Okay? Flexion of the neck. Okay? It shouldn't be extension. So for 63, letter apple. Okay? 64, this is the largest blood vessel in the body and runs up in the right sides of the lumbar vertebral bodies and behind the peritoneum of the posterior abdominal wall. It enters the right atrium at the lower right corner of the heart. Okay? Ano po ang answer natin for this one since it's the largest blood vessel? Okay? And nakakonect to siya sa right atrium nyo, meaning this would be a vein. Tama po ba? This would be a vein. Ang clue nyo pa is that it comes from the lumbar region of the body. Okay? And the posterior abdominal wall. So kung magagaling yan from below, okay, it should be inferior. Tama po ba? Therefore, ang answer nyo would be letter boy. Tama ba? 64, it's your inferior vena cava. Letter boy. 65, in pedal meniscus injury, the following conditions apply except blank. Okay? Sino po ang mali dito sa ating mga choices? If you would look at your letter cat, okay? Sabi daw, there may be loosening of the cartilage at its central attachment. Okay? Tama po ba yun? Okay? Based from a journal, The Knee Disorders. Okay? In this statement, ang mali po dito is the central attachment. Okay? Your pedal meniscus injury happens if there's loosening of the cartilage at the peripheral. Okay? At the peripheral attachments. Okay? It should not be central. It should be the peripheral attachments of the meniscus. Okay? So for number 65, it's letter cat. Okay? Letter cat. Okay, number 66. 2 or 3 muscular contractions that do not require expenditure of oxygen made possible by chemical energy provided by ATP stored in the skeletal muscles is referred to as what? Okay? Madali lang pong hanapin yung answer dito. Check nyo lang kaagad. There is no expenditure of oxygen. Okay? Hindi po siya gumagamit ng oxygen. Therefore, ano po ang tamang term dito pag hindi ka gumagamit ng oxygen? It's anaerobic. Tama po ba? It's anaerobic. So, ang answer nyo would be letter apple. Okay? It's your anaerobic metabolism. Okay? Anaerobic metabolism. 67. This ligament of the vertebral bodies limits backward bending and supports the anterior convexity in the lumbosacral area. Okay, sino po ito? If this ligament covers the anterior portion of the vertebral bodies and prevents, okay, extension of the spine, that would be your ALL or your anterior longitudinal ligament. Okay, 67, letter cat. Okay, 68. Indications for skin traction are as follows, except, okay, to relieve muscle spasms, yes. To treat stable fracture, particularly in the hip subtrochanteric region, yes, tama po yan. Pre-operative fracture treatment before internal fixation of a fractured hip, tama din po yan, okay? Those are indications for skin traction. Pero if you would look at letter boy, patient with a fracture requiring prolonged traction or traction force beyond 10 pounds or 4.5 kilograms, okay? This would no longer be indicated for skin traction, okay? Take note, this is already indicated for skeletal traction, okay? For letter boy, again, this is indicated for skeletal traction, okay? Letter boy. Okay, number 69. Traction is an important form of orthopedic immobilization. The following statements are true except blank. Okay? Alin po ang tama dito sa ating mga choices? Okay? If I would be considering, okay, if ko-consider natin dito ang ating mga choices, ang mali po dito is your letter dog. Okay? It's your letter dog. Okay? Unlike the traction pull, is not an effective counter traction. Okay? So to just give you a brief background, so based on the book of your working with orthopedic patients, okay, lumang libro na po ito na ginagamit pa nila for the APK boards, okay? Counter traction may be produced by other weights or by positioning the patient's body weight against the traction pull, okay? Although traction often requires confinement to a hospital bed, it does allow the patient limited motion. Okay? So meaning, your counter traction is still effective. Okay? It is still effective. Hindi naman po siya necessarily not effective. Okay? So, it should be letter dog. Okay? Effective pa din po yun. Okay? Next. Number 70, this muscle sole concern is flexion of the elbow joint. It was an extensive origin from the whole lower half of the shaft of the humerus and inserted by a tendon into the tuberosity of the ulna below the coronoid process. O, sino pong muscle yun? Okay? Siya lang po ang katangi-tanging elbow flexor natin na nag-i-insert sa inyong ulna. Sino po yun? It's your letter cat. Your triceps, your letter cat, your brachialis, okay? Your brachialis muscle, otherwise known as our workhorse muscle for elbow flexion, okay? 71, the following statements are true of the anatomical snuff box except, okay, sino po kaya to? Na-discuss na natin kanina, sino po yung mga nagbabound ng ating anatomic snuff box? It's tunnels 1 and 3. Your Apollo E pobre and your EPOL or your extensor pollicis longus. So ang mali po dito is letter apple, correct? It is bounded laterally by the tendon of the abductor pollicis brevis and extensor pollicis longus. Okay? Parehong baliktad. Okay? It should be the abductor pollicis longus and extensor pollicis brevis. Okay? Dapat vice versa yung longus and brevis. Okay? Baliktad. So for 71, it's apple. 72. Example of syndesmosis. Nasabi na natin kanina sino yung example natin ng syndesmosis. It's your inferior tibiofibular joint. Therefore, it should be letter boy. Tibia articulating with the fibula in the ankle. Okay? With the ankle. Letter boy. 73, cervical traction is applied following fractures or dislocations of the cervical or high thoracic vertebrae. The following statements apply to tongues used in cervical spine traction except blank. Okay, sino po ang tamang sagot dito? Okay, I will already proceed with the correct answer. Ang sagot po dito, it's letter boy. Okay, bakit po siya exempt? Patient is not encouraged to feed himself since he cannot turn on his side for feeding. Okay? Ang tama pong sagot dito, or ang tamang statement for this one would be like this. Okay? Sabi daw, for that, okay, you need to encourage your patient to feed himself if possible. Okay? Turn him on his side for feeding, supply a high protein and high caloric diet or a soft diet if it's painful for your patient to chew. Okay? Meaning, pwede pa din. Okay? You cannot restrict the patient from feeding. For this one, if it's possible, pwede nyo siyang pakainin. Okay? So again, our answer for your number 73, it's letter boy. Okay? Letter boy. Okay. 74. The following statements apply to the auscultatory method for measuring systolic and diastolic pressure except blank. Okay? Unahin ko na ulit kayo. Letter apple, sabi daw, the auscultatory method is very accurate. Values are within 11% compared to direct arterial measurements. Okay? Bakit po ito mali? Because based on your Guyton, okay? Based on your Guyton, the auscultatory method is not entirely accurate. Okay? It is not entirely accurate. Values are within 10%. Okay? Paki-take note. It should be 10%, not 11%. Okay? Again, 74, letter apple. 75. Muscles of the digits that have both proximal and distal attachment in the forearm or humerus is classified as blank. Ano pong muscle to? Okay? If both the attachments of the muscles of the digits are located inside the forearm or in the humerus, okay? Ano pong tawag dito? Letter dog, okay? None of these. So, paano naman nila mapapagalaw yung digits nyo if located lang sila within the forearm, di ba? Or within the humerus. Hindi man lang sila nakakross in the hand region. So, syempre, none of this. Non-existent yung ganong klaseng muscles. Okay? It's none of these. 76, the proximal IP joint of the hand is stabilized in order to test this muscle. Sino po to? It's your FDP, right? Because your FDP primarily flexes which joint of the hand? It's your DIP. Okay? It's your DIP or your distal interphalangeal joint. Okay? Kailangan nyo pong stabilize si PIP so to prevent any further additional actions coming from other muscles such as your FDS. Okay? So again, for this one, it should be your FDP for the DIP joints. Okay? So, 77, two forces whose points of application occur on opposite sides of an axis and in opposite direction to produce rotation of the body is blank. Okay? Sino po kaya ang muscles na ito? Okay? This is what we call your force couple. Okay? Your force couple. Diba? Bakit po? It's because they both act in opposite sides or in opposite points of direction, but they perform synchronously in order to perform a certain movement of your body. Like for example, you have your upper trapezius, your lower trapezius, and your serratus anterior, which all combine to provide the upward rotation motion of your scapula. Tama po ba? Okay, that's an example of your force couple. Okay, so for number 77, it's letter cap. 78, nerve cells at rest are positively charged on the outside and negatively charged on the inside. Kapag po ganito, ang status ng inyong nerve cells, this is an example of a resting membrane potential. Okay, kapag positive outside, negative inside, that is a resting membrane potential. Letter boy. 79, the following statements are true of the cruciate ligaments except, okay, tingnan nga natin, A, B, D, and E, they are all correct. Okay, A, B, D, and E are all correct. Okay, sir, baka tanungin niyo ako, bakit po nagpe-prevent ng side-to-side movement ang cruciate ligaments niyo? Okay, based from your Basmaidjan, okay, from your Basmaidjan, sabi niya, there are several structures that prevent displacement sideways of the knee. Okay? It can either be the collateral ligaments, the cruciate ligaments, and the intercondylar eminences. Okay? So, pasok. So, meaning, tama po si letter egg. So, ang mali dito is letter cat. Bakit? Because usually damaged by violent force that drives the femur backward while the knee is extended with the tibia fixed in position. Okay? The mechanism of injury for your cruciate ligaments for this one, okay, ang mas nagiging MOI niya is kapag na-drive yung femur nyo backward while the knee is flexed. Okay? When the knee is flexed. Okay? It's not extended. It should be flexed. Okay? Yes, pwedeng masira ang ninyo with hyperextension of the knee, but in a closed kinematic chain, if the patient's femur draws backward, okay, when the knee is flexed, okay, with the tibia fixed in position, then your cruciate ligaments can be damaged. Okay? So it should be flexed, not extended. Letter cat. Okay? 80, afferent component of muscle stretch reflex. Sino po to kapag afferent ng ating muscle stretch? It's your muscle spindle. Okay? It's your muscle spindle, letter boy. Okay? 81, this mixed nerve supplies the muscles of mastication. O paulit-ulit na tayo dito. May 3 branches. May ophthalmic, may maxillary, and mandibular. It's your, okay, letter apple. Your trigeminal nerve or your cranial nerve 5. 82, okay, number 82, an individual who is exposed to high heat stress will show increased blank. Okay? Kung ang isang individual ay exposed to high heat stress, okay, there would be increased sweat rate, of course, magpapawis to ng todo. There would be increased skin temperature, and there would also be increased heart rate. Okay? Lahat po yan ay increased. Okay? 82, all of these. Letter cat. Excuse me. Okay. 83. With the subject sitting and the knee relaxed in 90 degrees of flexion, these distal enlargements of the femur can be felt anteriorly on both sides of the patella. Okay? Sino po ito? Kapag po nag-bend ang ating knee in 90 degrees of flexion, okay? The distal enlargements of the femur, what do we call them? They are your condyles. Okay? Very good. They are your condyles. Letter boy. 2 major grooves on the lateral surface of the brain. Okay? Kung natatandaan po natin, so dinrawing ko kanina ang inyong brain. Tama po ba? Okay? So kunyari ganyan na lang. Okay? You have divisions in your brain para masabi natin ang different parts of our lobes. Okay? Meron ka dyan, meron ka dyan, meron ka dyan, meron ka din dito. Okay? Tama po ba? You have your median longitudinal fissure. Okay? You have your central sulcus of Rolando. Okay? Burahin ko lang to. Okay? You have your lateral sylvian fissure. Okay? You also have your parieto-occipital fissure. Okay? Tama po ba? Yes, you have, okay, a total of 1, 2, 3, 4, 5. Okay? 5 major fissures kasi dalawa po ang inyong lateral sylvian fissure. So lahat po ba nandito? May central sulcus ka of Rolando, meron ka ring lateral fissure of Sylvius. Therefore, both of these are two major grooves on the lateral surface of the brain. Okay? Both of these. 85, if conditions are right, once an action potential has been elicited on the membrane of a normal fiber, the depolarization process will travel over the entire membrane or not at all. Okay? This is called what? Ano po kaya to? Okay? This is your letter. Ding, 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 ding. It's your letter dog, your all or nothing principle. Okay? If, again, kapag po na-formulate niya ang action potential, okay, sabi, if conditions are right, once an action potential has been elicited on the membrane of a normal fiber, the depolarization process will travel over the entire membrane or not at all. Okay? Depending on the level of action potential that has been propagated. Okay? So it's your all or nothing principle. Letter dog. 86, this instability occurs with a tear of the arcuate complex. Okay, the result of adduction stress test is positive at 30 degrees of flexion, as is the result of the external rotation recurvatum test. Lateral tibial condyle has posterior subluxation in this instability. Okay, tingnan nyo na yung clue words nyo dito. Okay, you have lateral tibial condyle, okay, with posterior subluxation in this instability. Okay, it means that if I provide posterior, okay, a posterior force on the tibia, the lateral tibial condyle will protrude. Okay, it will protrude. So postero, tapos may lateral pang nagprotrude. Therefore, your best answer here is letter apple. Okay, your posterolateral instability. Okay, posterolateral instability. Siyempre, it's impossible that it's B, D, or E. Kasi hindi naman anterior yung force ng direction, diba? Or subluxation. It's posterior. So you're only given one answer. It's your letter apple. Posterolateral instability. 87. Which hip repair surgical procedure is indicated for severe hip pain from degenerative joint disease in elderly patients who are poor surgical risks and have little prospect of walking? Okay? So for patients like this, okay, for elderly patients who are poor surgical risks and have little prospect of walking, okay, ang nire-recommend po sa kanilang surgical procedure would be your arthrodesis, letter cat. Okay? In case po, meron kayong copy ng APK na hindi naka-enumerate ang arthrodesis, okay? In the original APK passboards, meron pong choice na arthrodesis. Okay? It's the letter C na nawawala. Okay? So if wala po siya sa copy nyo, please put an arthrodesis option, letter cat, okay, below the following choices, and yun po ang ating answer. Okay? It's your arthrodesis. Okay? 87, letter cat. 88, an intramedullary rod or screw plate is an internal fixation device used in this fracture type. Okay, kung gagamit ka ng intramedullary rod or screw plate, this is used for femoral shaft fractures. Okay, femoral shaft. Boy. 89. The following statements apply to the principle of one-way condition except, okay, from the name itself na one-way, ano pong i-expect natin, okay? It's only a one-way direction. Therefore, sino po ang mali? Letter boy, signal may be transmitted both direction but only one way at one time. Okay? Again, there's only one direction. Okay? Hindi siya pwedeng mag-alternate. Okay? So for 89, it's letter boy. Okay? Only one direction. Okay. Konti na lang guys. Kaya natin to. Number 90. If the angle is greater than 180 degrees on the medial side of the knee, okay, on weight bearing on one leg, the condition is referred to as blank. O kanina, sabi natin, kapag daw less than 170 degrees on the medial side, you would expect that there is genu varum, okay? There would be genu varum. However, in a patient wherein the angle on the medial side of the knee is greater than 180 degrees, baliktad naman ang magiging deformity, it's your ginovalgum. Okay? Your ginovalgum or your knocked knees. Okay? Your knocked knees. 91. Okay? Intense discomfort that usually accompanies an injury or inflammation may immobilize the patient. Okay? Just look at your keywords. Injury or inflammation. Kung injury or inflammation, that would be relevant to your acute pain. Tama po ba? Acute pain. Kapag may inflammation, it's acute in nature. Okay? Letter dog. 92. Which of the following is true of the atlanto-occipital joints? Tingnan nga natin. The interior and posterior arcs of the atlas are united to the margins of the foramen magnum. Yes, tama po ito. These are uniaxial synovial paired joints. Okay? Based on its old reference, your Basmaijan, this is correct. Okay? It's uniaxial synovial paired joints. Okay? But it's considered in some references as biaxial as it has the ability to laterally flex. Okay? To move in lateral flexion. Okay? Pero for this one, considering yung context ng ating APK past boards, okay? Since this is an old reference, okay? This is still correct, okay? It's uniaxial and synovial paired joints, okay? And it's also the yes, okay? The yes joint of your neck. Okay? So for your number 92, it's all of these. Okay? All of these. 93. The following consideration apply to broad-based quad cane except, okay, uunahan ko na ulit po kayo. Ang answer dito would be letter dog. Check nyo si letter dog. Ano sinabi niya? When using the cane, body must be erect as he walks and may lean over the cane. Okay? So may kita nyo kaagad, meron na naman tayong contradiction. Ano sinabi? Dapat daw erect ang tayo nyo. Okay? Meaning upright yung posture while you're using the cane. Okay? Therefore, there should not be any leaning motion of the trunk. Tama po ba? Okay? When you use the quad cane, hindi po dapat tayo gumaganyan, di ba? Wala tayong ewan. Okay? Dapat erect ang posture natin, okay, while you're using the cane. Okay? There should be no leaning on the cane. Okay? There should be no leaning over the cane. So, ang answer natin would be letter dog. Okay? Letter dog. Okay, number 94. The muscles of mastication. Okay, ano-ano po ang muscles of mastication natin? You have your masseter, you have your temporalis, you have your medial pterygoid, you also have your lateral pterygoid. Okay, you have 4 primary muscles of mastication. That's letter apple. Okay, letter apple. Your temporalis, masseter, medial, and lateral pterygoids. Okay? 95. Delayed union is a fracture complication wherein callus formation is retarded, so the fracture fails to mend within the normal healing time. Factors contributing to this complication include the following except blank. Okay? Unahan na natin. Ano po bang vitamins, okay, ang important for the development of your bones, okay? Or for the maintenance of your bone health? You have your A, you have your C, you also have your D. Tama po ba? Okay? So ano po ang mali dito? It's your letter dog. Okay? Vitamin E deficiency. Okay? Primarily, when it comes to bone health, okay, ang best vitamin would be your D. Right? Vitamin D. Bakit? Because your vitamin D is important for the absorption of calcium inside the body so that it can help in the mending of your bones. Okay? So, for this one, ang mali natin, it's letter dog. Vitamin E. Okay? It should be more of your vitamin D. Okay? Vitamin D deficiency. 96. The most serious cardiac arrhythmia resulting from cardiac impulses re-exciting the same ventricular muscles over and over. Sino po to? It's your letter dog. Your ventricular fibrillation. Okay? Ventricular fibrillation na to. Kasi kapag ang patient nyo ay mayroon ng ventricular fibrillation, okay, this is a matter of life and death to your patient. Okay? Kapag ito po ay hindi naagapan, therefore it can lead to cardiac arrest. Okay? So for 96, it's your letter dog. Okay? 97, decreased resistance to passive manipulation of the limb. Okay? If there's decreased resistance of the muscle towards passive movement, okay, meaning decreased ang tone ng inyong pasyente, okay, what would be the term for that? It's your hypotonia. Okay, siya lang naman yung naiiba sa choices eh. All of the choices are about hypertonia, okay? Pero kung decreased ang resistance, it is hypotonia. Okay, letter boy. 98. This thick plate of commissural fibers unite the two cerebral hemispheres. Sino nga ba yung nabanggit ko kanina? Okay, na commissural fiber, yung pinaka-popular sa lahat, it's your corpus callosum. Right? It's your corpus callosum uniting the two hemispheres of the brain. Okay? Letter apple. 99. If your patient cannot support full weight on either of his legs, which crutch walking would you choose? Okay? So again, this came from a book, okay? The old book of Providing Early Mobility. And if we're going to base it verbatim from their statement, the best answer for this would be 4-point gait. Okay? Your 4-point gait, that's letter apple. Okay? 99, that's letter apple. Okay? 4-point gait. And lastly, number 100, involuntary but slower twisting movements causing transient, odd, and unnatural posturing, most evident in the distal parts. So, if this occurs in the distal parts of your extremity, slow, involuntary, worm-like, diba, writhing movements, ano nga pong type of movement disorder ito? This is best known as your athetosis. Tama po ba? Okay? Kapag po involuntary twisting but slower movements at the distal extremities, okay, this is described as your athetosis. Okay? So for our last number, number 100, it's your letter cat. Okay? Your letter cat. Okay, and that concludes our rationalization for your APK 1997. So I hope na run through nyo po lahat ng ating mga discuss and clear po sa atin. If meron po kayong questions, please do not hesitate to ask me for clarification. Okay? So maraming salamat po until our next APK rationalization ulit. Okay, so bago po natin i-end ang ating discussion, of course, let's have a short prayer before we end. Okay, let us pray. Father, maraming salamat po for this opportunity. Thank you for giving us the strength, the endurance, okay, to listen for all these lessons, these review topics that we are going through in the APK 1997 rationalization. Nawa po, Lord, sa amin pong mga naaral ngayon, ma-apply po namin siya always, not only through our board exam, but also for the application in our clinics as well. Lord, may you give us, may you revive our strength, okay, our burning desire to pass the boards, and may each and every one of these students get their dreams of passing the boards and getting their licenses. We thank you and we love you, Lord. In Jesus' name, amen. So thank you guys. Sa susunod po ulit, okay, we'll meet again for your APK 1998 February. Okay? So, thank you guys. God bless and we'll see each other again. Thank you.